United we're as strong as a mountain. United we're as deep as the sea.
This meeting is not a rally. It's a speak out, and it's a press conference to alert the public about what's going on and also to support the workers of Laguna Honda. My union, University of Professional and Technical Employees, CWA, passed a resolution during its previous convention on July 31st, opposing the closure of Laguna Honda Hospital. My union represents 18,000 workers in the University of California, as well as 3 community colleges. We are a public sector health and education worker union, and we have social workers as well, some of whom are here as well with us, who have patients that get sent to Laguna Honda Hospital. The message that I would like people to understand is that privatization kills. We cannot be fooled by this attempt at closure of a perfectly viable institution that is set, according to latest news, is set to be recertified in January, yet vulnerable patients are being transferred out unnecessarily and are dying. We cannot be fooled that this closure on this prime real estate in San Francisco has any other intention than to privatize this land. This is a public resource that is, as Steve Zeltzer pointed out, is the only place in San Francisco that accepts patients that are on Medicare, the only skilled nursing facility that accepts patients on Medicare. I will tell you a personal account of mine where my grandmother, back in 1996, suffered a stroke. She was 85 years old. She lost the ability to speak as well as some mobility. If not for the treatment that she received during the approximately 3 to 6 months, 3 months that she was here by the trained personnel here, she would not have regained full motion, full mobility, and full cognitive function. So I will be forever thankful to her, to Laguna Honda Hospital and its workers for providing that level of service, quality service that saved my grandmother and allowed her to live until she was 91 years old. So what I want to say is that it's time for healthcare workers to get together from all the different unions and all the unions to support each other in this endeavor in stopping the closure of public resources. My union passed a resolution demanding an end to the closure and an end to cutting off the beds by 120. We presented this resolution at the San Francisco Labor Council. Unfortunately, due to a lack of quorum, it could not be discussed, but we did speak with the leadership at the San Francisco Labor Council, which told us that they were just as concerned that they would not permit this to go on as well, and that there is going to be a pending rally with the workers of SEIU and the workers represented by the San Francisco Labor Council to also oppose this closure as well. Thank you very much.
What I want to say is we've been hearing rumblings, and I represent the employees who work in this building, the ones providing the care. They do it here. They do it at San Francisco General. They do it at healthcare clinics. We are all dedicated to the public. We want to give the best care. But if you talk to employees at Laguna Honda, they will tell you there are many times where they have gone to management about different issues, and they've gone unaddressed, and so here we are. So what we want to do is send a message out to the public. The public employees cannot do this alone. We can't save Laguna Honda for you alone. We need all of the public to be calling their senators, to be calling their congressmen. If you know somebody at the White House, you call whoever you have to, because we cannot lose Laguna Honda. There is nowhere else for people to go. I have a friend of mine who's a co-worker out at General. Her mother needs Laguna Honda, but guess what? Now she's on a waiting list. Now she can't find anywhere for her mother to go. And it's causing a lot of trauma within her family. So this cannot be allowed, because people are involved in all of this. People are being harmed when there's no bed at Laguna Honda, and they're not rich, and they can't afford to pay a private duty nurse to come to their home and take care of their mother. And that's who we're talking about. And that's most San Franciscans are not able to do what I just said. They're not able to pay cash and have somebody come to their home and be a private duty nurse so they don't have to worry and they can continue to work. So please, I'm calling to the public, please, the government needs to hear from you. I know I talk to people all the time who say that they do not support Laguna Honda being closed. They're outraged at what has happened. But I'm saying don't be angry with the employees because it's not their fault. They didn't create this mess. So now we have to save it, and the employees, and I know they brought management from San Francisco General over here to try to fix this, and I know those people are good people, and I'm sure they're doing everything they can, but they need the help of the public. They need the public to speak out and support. And they need to hear it from you because it's very demoralizing working in this type of environment and not hearing anybody supporting you. All you hear is negative things. There's a lot of positive things still happening at Laguna Honda today, even though everybody's focusing on the negative. But all those negative things are being worked on. So please, public, we need your support. We need you to speak out to your supervisors and everybody else and let them know we cannot lose Laguna Honda under any circumstances.
Good afternoon, everyone. My name is Cheryl Thornton, and I am a SEIU 10-to-1 member, as well as the Vice President of the Community Health Chapter, as well as a Labor Council delegate. And I am not born in San Francisco, but I was raised in San Francisco, and I've seen the change. And we cannot lose Laguna Honda. This is part of a bigger picture of privatization and gentrification. But it's also corruption, because we are attacking the people who are the most vulnerable in San Francisco and reducing services. Laguna Honda is a public facility, the only one in the nation this large. And so to privatize this is like part of the gentrification of San Francisco. Low-income people who have strokes or need to be rehabilitated or so forth need to have a facility like this in San Francisco. When my dad was sick with cancer and needed a facility, at the time we lived in San Bruno, I could not find a suitable facility, and he was not eligible for a facility like this, and he was a dentist for the city and county of San Francisco. Many of our city workers use this facility when they get sick. So I am asking the powers that be to not close this facility, to do whatever you can to save this facility, to not take this land and privatize it and put more expensive condominiums. I know the land in San Francisco is very valuable, but we need people from all walks of life to be able to live in this city. So please stop the corruption that's happening here at Laguna Honda. Stop the closure, because this really is corruption. So thank you.